And now I'm here with Kabir Sheikh. He's the board chair for Health Systems Global. Thanks so much for joining me.
My pleasure.
You just published your new strategic plan. What do you consider to be the organization's priorities for the next 5 years?
Health Systems Global is now 4 years old. We were established in 2012, and I think in a way we are now entering a phase of a sort of a maturation phase, or an adolescent phase, if you like. And we see ourselves at this stage really wanting to focus on a couple of things. I would say one is to really get an inroad into getting impact into country health systems and making sure that our membership is equipped in the right way, we can support them in the right way to actually bring about some changes in strengthening health systems in their own countries. I think the other area where we'd really like to focus attention is on addressing some key global health discussions and contributing to some key conversations and to even to resolutions that promote health systems in general and promote health system strengthening in particular. So that's where I see us going.
And what do you see to be the opportunities and the challenges facing Health Systems Global?
So I think the challenges and opportunities in fact stem from a similar kind of an understanding that health systems and the idea of systems and systems thinking is really is porous. The idea that systems are actually not sort of consolidated entities, but they're networked entities, and in fact health systems operate contiguously and in connection with food systems, agricultural systems, water systems, and they have deep connections with issues like equity and poverty. And these are all issues, say for example, that have been outlined in the Sustainable Development Goals. And now this brings very clear opportunities for us to, when we think about health systems, that it shouldn't just be a discussion on how to improve health services, but also how to improve all these other sectors that also contribute ultimately to better health. The challenge is similar in that it creates something of an identity issue for us, and carving an identity when we are actually a much more porous kind of have that kind of porous role or networked role is something of a challenge. But we need to, and Health Systems Global can go some way in helping to carve and forge that identity.
Can you speak a little bit about what a resilient and responsive health system means for you?
So ultimately, I think for me, resilience and responsiveness speaks to the issue of health systems being very keenly aware of what are the needs of the communities and the societies that they're serving, and both present and future needs. And so I think to address that, communities need to have robust public health and clinical care systems in place. They also need to be very aware of inequities and the disparate availability of resources and of services to people in their communities. And they also need to be vigilant to the kinds of external stressors that sometimes come to bear on them, whether they are economic stressors, whether they are burgeoning epidemics. So it's a range of factors that contribute to a resilient health system.
What about the role that health policy and systems research plays in building these systems?
Well, health policy and systems research has a critical role because it helps us to analyze and to make sense of some of the quite complex factors that contribute towards better systems. It's an evolving field, and there are emerging methodologies, and we don't have all the answers. But I think in some ways we'll never have all the answers. But the growth of the field is contributing to better solutions in the field, to the implementation of large-scale programs in countries, to help us to understand how to either to implement them better or to address more fundamental systemic factors, and also issues and also factors that condition and shape health systems overall.
Great, thank you so much for your time.